Top Med Talk.
Hello, and welcome to Top Med Talk. I'm Desiree Chappell, and we're coming to you with coverage of the COVID crisis from the front lines. Now, we've had phenomenal conversations with care providers all over the world who either on the ground themselves taking care of COVID patients or playing a more supportive role in the battle against coronavirus. Now, we're going to continue to share these stories in hopes to provide resources and support for all the healthcare workers out there taking care of the COVID patient. So today, I'm joined by our editor-in-chief in London, England, Monty Mythen. Hello, Monty.
Hey, Desiree. Great to see you. Great to talk to you. Very excited about where we're going next, because one of my little secrets is my first big foray out of the UK was a long way away from the UK to do a job which I really, really enjoyed, a long way away from home. Yeah. And another secret is how much time I spent skiing while I was doing the job.
Oh, okay. Well, maybe you should keep that part a secret. So Monty is alluding to our next guest and staying true to form, our global reach. Our next guest is coming to us from Campbell's Bay on the North Shore in Auckland, New Zealand, Dr. Julian Fuller. Hi, Julian. How are you doing?
Very well. Good morning, Desiree. Good morning, Monty, or good evening, your time.
Not all the time zones covered, but we have the major ones covered. Oh, go ahead.
Yeah, I just my little secret, which I think Julian knows, is that a long time ago I was very privileged to go as a young doctor to work on the South Island of New Zealand. People who don't know New Zealand that well, it's a relatively long and thin island that goes from sort of subtropical all the way down to fjords. And I worked in Canterbury in New Zealand on the South Island. Which also has the luxury that if you get your job right, I was working in accident and emergency, you could actually manage to volunteer for a lot of night shifts. You could drive up the mountain and ski and still make it back to having a little bit of sleep on the minibus to do a night shift and repeat. What a beautiful, amazing place.
That sounds great. Well, Julian, you don't sound like you're from New Zealand. So can you tell us your story about how you ended up there?
Yeah, I was born and bred in England and left England to go to Cape Town University with my family. And after graduating in medicine there, an anaesthetic, I ended up taking our family to New Zealand about 28 years ago. So I've been here ever since. And I've been in Auckland for the last 22 years.
Oh, okay.
And yeah, having a wonderful time. I ride my e-bike a lot during the lockdown, like we're in like most of the world, and frequently ride down to the beaches nearby, 5 minutes away, and look over the sea and say, my God, this is not a bad place to be in lockdown.
Julie, what's an e-bike? Is like a virtual bike? Or
I've got a German Kreidler sort of electronic bike. It's an ordinary bicycle, but with a motor on, Bosch electronics. And it just takes the edge off riding when you're facing a hill or a headwind.
So you've still got a pedal, but it gives you a bit of a lift.
You've still got a pedal, yeah.
That's awesome. Well, Julian, for our listeners out there, can you tell us what you do there in New Zealand? You're obviously a physician, but what is your specialty and where do you work?
So, yeah, I'm a qualified anaesthetist and predominantly in anaesthetics now. I used to do intensive care as well as anaesthetics, and I work in one of the three major hospitals in Auckland. And our hospital, North Shore Hospital, drains 650,000 people and has about 660 beds with an ICU of 8 beds and an HDU of 8 beds. And I do sort of all forms of anesthesia except cardiac and major vascular.
Tell us about what is happening there on the ground. You were describing kind of the COVID situation there. Obviously, it's a global crisis, but you guys maybe had a little bit longer time to prepare for it.
Yeah. I mean, there's no doubt at all that in Australia and New Zealand, at the other end of the world, we've had a huge run-in to COVID, learning from you guys in America and Monty in the UK and all the guys in Italy and Spain. And so for us, it's literally been a little bit like deck chairs on the Titanic, waiting to see the iceberg coming over the horizon, or basically the tsunami of cases coming in. So we've had a huge run-in, and we've learned from you guys. We've learned from the importance of doing drills and preparation and organization and logistics. And funnily enough, I think Monty would probably agree with me that most anaesthetists seem to be sort of techno nerds. We love our gadgets. And to be honest, we've probably led the whole preparation here because of the number of people who are connected. We're very connected within our department. We meet all the time by Zoom. We meet on various other apps, like one called Slack. And I think it's meant that we've been able to share information from you guys very rapidly and disseminate it around our own areas.
Yeah.
One of the things that we were discussing on Top Mid Talk very recently, based on a report from Tim Cook, is that we've seen a disturbingly high number of deaths in the UK overall. But in healthcare providers, we'd seen a lot in the Black and minority ethnic community. And most of those have been in people away from the front line. So we get the impression that our personal protection and our drills and our practices for intubating patients and intensive care and physiotherapies worked really well. But we're now disturbed by the fact that we didn't get the contagion under control, that possibly within hospitals or communities we infected each other because we didn't take that component of it seriously. Whereas when I look at the global reports, Australia and New Zealand seem to have it locked down. New Zealand in particular, you seem to have almost gone to no cases.
It's almost embarrassing compared to you, but as of yesterday, we'd done just over 101,000 tests for 1,500 confirmed and probable cases. But unlike you, we include all COVID deaths in rest homes and all COVID deaths at home. So those really are the total COVID deaths. And to be honest, the majority of our deaths, which stood at 16 only yesterday, have mostly all been in rest homes. So there's only one person under the age of 70 who's died. The rest have all been up to 90. The one person who died younger than that was 62, who died in the intensive care unit in Dunedin recently. But otherwise, you mentioned healthcare workers. We've had about 10% of healthcare workers getting infected. But the funny thing is, the moment you drill down into that, the vast majority were travellers or contacts with travellers. So very few have actually got it in the front line, very few.
Do you feel that there in New Zealand that there's been an issue with obtaining PPE or supplying PPE or anything like that?
I think we're very, very similar to elsewhere in the world. Yes, there's a disconnect between the ministry and at the highest level. They keep assuring everybody that there's enough in the country. I think it's the logistics, getting down to the GP clinics, to the smaller country hospitals. There's always a concern. And I think, to be honest, again, we've been very, very lucky so far in dodging a huge bullet. And everyone was a little bit worried about what would have happened if we'd been overwhelmed with it, like in London or New York.
Yeah, absolutely.
Because I think PPE has been terribly underestimated in how much you need.
Yeah.
And we are being reassured the whole time. They're bringing in stocks all the time ironically, from China. So, yeah.
I mean, there's the spectrum of, N95, full protection, hooded gear, PAPRs and everything, all the way down to just pure, surgical masks to help kind of prevent transmission. Are you guys within your hospitals insisting that everyone wear a mask at all times when you go into the hospital and then once you go out into the community?
We've had to adapt and look at what you've done in America, what's been recommended in England and what the WHO is recommending. But at the moment, I think everyone is told, if you want to wear a mask and it makes you feel more comfortable, wear one. Mm-hmm. It probably does little good to you. It might stop you infecting someone else. But people have been told, because we do have lots of very anxious nursing staff and medical staff, and they've been told, if you want to put a mask on, put it on. Mm-hmm. Otherwise, we've been very strict with who should be using N95 masks because of the risks, the same as all over the world. Yeah. Mm. Yeah. But we've obviously developed intubation teams and other high-risk teams and COVID teams. And I think like Tim and Hugh and I think Monty have implied, we were very quickly able to split our department into roughly COVID anaesthetists and non-COVID anaesthetists. And that's roughly on a 2/3 COVID and 1/3 non-COVID. And that's based on age and comorbidities.
From the community perspective, did you, as we call it now, lock down? Did you close schools, universities, bars, restaurants, or did you go middle ground on that?
As our lovely Prime Minister keeps saying, we went hard and fast.
Yeah.
And I'm just looking here. We had our first case 49 days ago. We went into self-isolation for all arrivals in New Zealand when we had 6 cases only.
Yeah.
And we closed the borders completely to everybody when we had 20 cases. And we went into lockdown, complete lockdown, 4 weeks ago when we had 200 cases. And that lockdown has been everything except essential workers, exercise, walking, and going shopping.
Looking from a distance, from repeated things that she has done, your leader, your Prime Minister, just seems like an incredible leader. Is that just the optics that we're looking at it through, or is that the way you feel it there as well?
There's always party politics, but the one thing that she's transcended, I think, here is that she shows compassion the whole time she speaks. She's very compassionate, she's very clear, and she's got a very good speaker who speaks next to her, Ashley Bloomfield, who's a doctor, who's the Director General of Health. So he runs the ministry below the minister. And he's been very clear and very, very good as well. And that's what's really made it very different. I think there's never been much debate. She's pulled everyone along with her, whether they're left-leaning or right-leaning, and Jacinda heads the Labour Party. But she's done incredibly well here. She really has.
Can you tell us just briefly, is it a national healthcare system much like the UK? Is it mixed, or is it...
I'd echo comments that other people have made that, yes, we run very similar to the UK with a national health service, which makes handling any form of pandemic or national public disease so much easier. So the vast majority of people are able to access care in the public health system, and maybe 15 to 20% of people carry private insurance to go private. But when the rubber hits the road, the public health system is exactly the same as in England. It handles all acute medical care and obviously pandemic care. So it's been very good, yeah.
The patients that you are seeing there in New Zealand, are they presenting much like the COVID patients have been in other parts of the world, or are you noticing anything different in the way that you're taking care of these patients? What is that like?
No, it seems very much the same, but I keep getting back to the fact that compared to you guys, we're honestly having a holiday here. As of yesterday, there were only 8 patients in hospital in the whole of New Zealand with COVID. Mm-hmm. We've made a point here of everybody who's got COVID who can be treated at home is treated at home, and several of my colleagues think that's one of the reasons for success.
Yes.
So they're only admitted if they really need hospital care.
So mainly just critical, like just ICU care only.
Almost ICU care. So, and in ICU right now, there's only 1 patient in the whole of New Zealand. But we've had an incredibly good run, which is all down to basically shutting down, socially distancing, hand washing, and lockdown. Yeah.
If there is any sense of there being any form of immunity as a result of having the contagion that we might be going through, what happens next if there isn't a vaccine? I mean, you have an almost entirely unexposed community, possibly.
The team who've been advising the PM have all really been talking now about the fact that obviously we, like probably a lot of the world, are going to wait for a vaccine. And it appears from my reading that the chances are quite good that a vaccine will be effective. Obviously, Oxford and 1 or 2 other places seem to be roaring ahead with developing them. So most people say that we're probably looking at a lockdown for the whole of this year, maybe, lockdown of the borders. So we'll be able to internally ease up and move around more. But I think our international travel is going to be very severely limited for the whole year.
And that's kind of okay, isn't it? We've got lots of things that all in all our own countries and our own states. There's lots of great stuff to do that we were so kind of brought up that being normal.
Yeah,
definitely. And I think that's all part of rethinking this whole thing of jumping on a plane and flying around the world at the drop of a hat. We've all been guilty of it. But having said that, one of the difficulties in Australia and New Zealand, if I look around at the workforce at my hospital, probably half the workforce originally comes from the UK. So what it means is that an awful lot of them have got elderly family, relatives in the UK.
Yes.
And it's quite distressing now for them knowing that they can't jump on a plane to visit their granny or their mother or father.
We'll have to allow that. Those sorts of trips are manageable. We need to manage that. I think
they are, and with the proviso probably of 2 weeks at either end, maybe.
Yeah, exactly. So, it's like we used to do when we used to do it by sea. It was a big decision to go. Well, it's the sort of stories my mother tells me. It was a big decision to go from Ireland to England. That was there was a once in a lifetime decision.
Julian, the last piece that I wanted to end on today was that you were describing a patient that you'd been taking care of. And so can you walk us through this case report that you have?
Yeah, I'd love to. Look, yesterday I had the absolute pleasure for a second time going to speak to Sanjay, who said expressly that I can use his name and I can talk about his case, because he's really keen that everyone understands how seriously ill you can get, but how you can get better with expert help and guidance. Sanjay was 41 and a Kiwi, originally from Fiji, so of Indian ethnic origin, and happily married with 2 kids at a high school in Auckland. And basically 33 days ago, his high school, the school that his kids went to, developed a case of COVID in one of the staff members. And 3 days later, it spread to a few of the pupils, to the extent that today it's the second biggest single cluster of COVID cases in New Zealand, with 95 cases. Sanjay developed fevers about 30 days ago, 3 days after the school got closed down. And it took a week of visiting his GP and asking and begging for testing, because they kept, in those days, testing, probably like in the UK, was limited to people who had to have a very strong history of travel or contact. Yeah. And so because he wasn't at the school and his daughters were tested and were negative, he wasn't tested. So it took him a week of visiting the GP and having fevers and taking paracetamol before eventually he drove himself to one of our outlying hospitals 23 days ago on April the 1st. And within an hour, he was admitted, and within 12 hours, he was transferred to our base hospital, North Shore Hospital. He was intubated 22 days ago on arrival and spent 16 days intubated and ventilated. He went through exactly the same type of treatment as in the UK, with proning from time to time, with deliberate avoiding barotrauma and volutrauma, and aiming at SATs of 88 to 93. He was incredibly fortunate in that he only ever had single organ failure. So he never developed the kidney failure. He was treated as Monty would love. He was treated wet. He wasn't run dry like in ARDS. And eventually he was extubated 6 days ago. I've been to chat to him twice since then. And he's an incredibly happy young man now, sitting up in his bed. Sadly, he still hasn't seen his daughters. He still hasn't seen his wife.
Yeah.
But his wife became ill. And then we've got incredibly strict rules on visiting. There's no visitors anywhere in the hospital except for compassionate reasons. So he did ask me to tell you what his memory was of being intubated. It was really very funny, but he said he was really sick and he was in this room, and the next thing he thought he must be dreaming and he must be watching a science fiction movie, as he thought that he was now part of the Apollo space mission. These odd people walked into his room, suited up like going to the moon. And afterwards he heard that they spent 2 hours doing a procedure that normally takes about 30 minutes because no one was quite sure what they should be doing. And all the time he just couldn't believe what was going on. And that was his funniest memory. But otherwise, he's done very well. He has nightmares. He has a lot of nightmares. He's still tube fed 6 days later because his swallowing hasn't completely returned. And he's got a degree of double vision, which we think is probably secondary to some of the proning that he's had. But that's going to be watched to make sure that it goes away. He's walking with help. And he just expresses unbelievable gratefulness to the nursing care and the medical care that he's received in a hospital. But he's probably the most classic case of COVID in a younger person in New Zealand, yeah.
Great. What a great story.
Yeah, that is. Yeah. Thank you. Thank you so much for sharing that, Julian. I think it's really important to hear the patient experience, especially whenever it's, taking it a step beyond just feeling, Monty had it and feeling bad, at home, but, having to go in and experiencing some of those things like the nightmares and that experience being intubated and having lines done and all those different things. That's
the team doing the proning, because a number of colleagues have had COVID-19 in London now, and neurological abnormalities from the neurotropic effect seem to span the whole spectrum of vestibular problems. We've all heard about the smell and taste problems, but swallowing difficult, just everything. So I think the good news is it all seems to get better with time.
He was the sole patient being treated in the intensive care unit at our hospital. He was in a negative pressure room. We had 2 negative pressure rooms. The trigger to move, we had a complete standalone hospital, which we converted from being an elective surgical center with 4 operating theaters and a large recovery room and 40 beds upstairs. That entire hospital was emptied out and converted almost like a military hospital into a COVID ICU with 18 ventilated beds, with theatres to use, even expansion, and then upstairs for the wards. We never used it for one patient. That was our insurance policy that ultimately I've kept saying to people, if we don't use it, well, so be it. It just proves we've dodged a huge bullet.
Yeah, well,
but yes, he was in a negative pressure room for a long time, and the nurses told me that their fortune was that they only ever had to look after one patient because they said it was so intensive, as Monty's implied, proning him. We had one patient with him the whole time, one in the airlock helping, who was also kitted up, and then two outside. So it really was incredibly labor intensive. And then for the rolls, he was clamshelled, rolled, proned with about 4 to 5 people each time. Yeah, very intensive.
Well, I've largely dodged that bullet as well by getting my COVID-19 at just the right time to avoid the complete front end. But I've witnessed it up close and personal, and they're working really, really, really hard.
When I chatted to him the other day with 2 other intensivist colleagues of mine, we talked about the BBC video that was put out there, which was so good. And we talked about it in front of him as, about whether or not there might be an advantage to him one day watching that video with his kids to get more of an understanding of what he personally had gone through, because it was an excellent video.
Yeah, it really was. And wow, what a way to kind of work through that experience for yourself. I would imagine it would be cathartic and therapeutic probably on his part, maybe a little bit scary, but...
Certainly, we've had a massive advantage being able to watch what you've done and learn from what you've done. And then I think because of our connectivity today, it's just been so easy to see exactly step by step what you've done that's worked and what you've done that hasn't worked. So it has been really good.
Thank goodness we have had those opportunities for everyone, in Spain and the globe. Hopefully we've learned a lot for ourselves too that we can take forward. Julian, I can't tell you how much we appreciate you joining us on Top Med Talk. It's wonderful to have your perspective there in New Zealand. Hopefully you guys maintain what you have going, because that is, phenomenal. Through maybe this flu season coming up for you guys, I guess will be a little bit more of a telltale sign as well, but keep up the good work there, and cheers and all those good wishes to you and your colleagues.
Thanks very much, Desiree. Thanks a lot, and thanks, Monty. We really have become a big global family, I think, more and more. And I think your Top Med Talks has made a huge difference to disseminating information and advice instantly around the world. It's been great.
Thank you. By the way, EdPom is on. Yep. We just might be doing it all from our own country. So if you can help us lead it down there, that's
right. Yeah,
it's definitely on.
Yeah.
It's on.
I've just been cancelling my flights to that.
That's a good idea.
Yeah.
But it's going to be on. It's just that your end of it's going to be in Auckland, if you should.
Yeah.
But we're going to do this. It's going to be fun.
Yeah.
We're going to do the virtual pub crawl and everything.
Guaranteed.
Top Med Talk.
On that note, well, thank you, Julian, and thank you for listening to this series, COVID from the Front Lines. You can find more like it at topmedtalk.com and by following us on your favorite social media platform. Stay safe, stay well. We're going to get through this together. Thank you so much for listening.
Top Med Talk is proud to thank its sponsors, specifically Edwards Life Sciences, for their generous support through this global crisis.